With more cases, thanks for staying with us, with more cases of COVID-19 recorded, and a number of things just seem to be happening, especially in Nigeria, a low level of compliance to safety protocols. Let's close today with a discussion on observing safety measures. And this morning, Dr. Tolu Olufunlayo joins us. She is Chairman, Association of Public Health Physicians of Nigeria, and she's also a consultant public health physician. Thanks for joining us this morning, Doctor. Well, it would seem like the issues are varied. Rising cases, non-compliance with COVID protocols, and then we still have on our hands vaccine hesitancy. How is your community managing all these?
Well, thank you, Ayo. Good morning, everyone. Definitely, it's a major challenge for the public health community in Lagos and around Nigeria. But, you know, everyone, what we believe is that it's a multi-sectoral effort that it would take to get us out of the woods, or to get us to flatten the curve of this fourth wave that we have just gotten into. As you've rightly said, there are rising numbers of COVID cases in the past several weeks. And this had been anticipated by the various health communities or the health sector because of the trends that we have seen in the past, and because of certain factors such as increased travel and increased social gatherings, coupled with, as you said, the hesitancy to vaccines and non-compliance with or low compliance to non-pharmaceutical interventions. So all these combine to make, you know, the transmission of COVID-19 heightened in our own community or environment, just as it is in other countries around the world. So today, I think I'll just lend my voice to that of the other, you know, health authorities around Nigeria and around the world to encourage our viewers and everyone out there to please celebrate responsibly. That's the campaign that has been launched by the Presidential Steering Committee to encourage us as Nigerians to, you know, temper it down a bit this Christmas and New Year. I know we all are happy that we've seen 2021 to the end, or almost to the end, and it's been a very difficult year. We want to see our loved ones who may have come from far and wide. But it's important to say that we need to be alive to be able to do all these things. And for that reason, we encourage all of us, first of all, to continue to observe all the non-pharmaceutical interventions. WHO says do them well, do them all. They've not changed really. So they include sanitizing our hands or washing our hands frequently, covering our cough, which many people don't do anymore, use of a face covering, face mask, covering the nose and the mouth, and then, of course, avoiding large gatherings. And we also ask that people should get vaccinated. And in Nigeria, we are now offering, the government is now offering the booster dose to those who have had at least 6 months between their first 2 doses to go back and get a booster dose from either any of the public health facilities or selected private health facilities. These really are the ways by which we can curtail this wave, and we will continue to talk about this.
Well, if one is to take a look at the progression of COVID-19 in Nigeria from its beginning, especially from the very beginning, tapping the progression, this thing there would show us how the journey has been, and it's until now. And we also understand that there's been a little spike in the past few weeks. I mean, and especially in the wake of Omicron, the Omicron variant. In your opinion, would you say that there is convincing information out there for people? This information that you have mentioned, there are things that people are aware of. But sometimes the consequences seem to pale in significance because, maybe people don't see how severe it is. Or what are the things that you think people should really take to heart about this? Something one of the officers that we spoke with earlier, foreign persons in the clip we listened to, said something significant. The virus is not on vacation. The virus is not going to take a Christmas holiday. We are the ones that are on holiday. So what are the things that you think people should pay significant attention to, especially now, beside the things that you have mentioned?
Okay, thank you. I think what is important is for us to tailor our risk communication to the people. We really need to go back to the people to find out what they really would want to hear and how they want to receive the message. We need to involve the communities in formulating these messages. Now, remember that in COVID-19, the information that we have received is progressive because this is a new virus, it's a novel virus, and each day, each week, each month, we keep learning new things and the new developments keep coming up. For example, the recent Omicron variant of concern. So, having information come in pieces to people and in progression sometimes makes them doubt the authenticity, how authentic the information is. And besides that, we all know that due to some other factors, there's a lot of mistrust, distrust between the people and the government. There's also a lot of misinformation and disinformation that goes on social media. And the best way to, address this is really to go back to the people. So we need to do a lot more community mobilization. We need to do the bottom-up approach. And, I can stay here and speak to the people, but the best thing is for us to take the people at the grassroots and engage with them. Then we'll hear what their issues are. We'll be able to get a lot of the mis and disinformation that they're receiving, and then we can address that with facts and, bring the information down to their level such that they are able to actually relate to the problem. You said that many people don't really see how COVID-19 relates to them since they've never seen anyone that has died from the condition, and it's not been as severe as we had predicted it would be initially. For that reason, there is need for that engagement. Some of the engagement has taken place, but I think we can still do a lot more, both at the government level and with other organizations such as ours, the Association of Public Health Physicians of Nigeria, amongst others.
Well, again, the microsite of COVID-19.ncdc.gov.ng shows us how we have dealt with this, how the cases have increased and tapered down over time. And one is when we look at the way the whole thing has been going, and the states or locations that have played up the most, they're also there. I'm just wondering, you talked about the risk communication being tailored to the localities, especially the people that are most affected by these things. In terms of tailoring it, the NCDC, of course, will tell us that, look, we have been doing this, we've been trying as much as possible to focus this thing in the people's languages to the people where they are in the various localities. So how well would you say we have fared in that regard? That's one. Secondly, many people traveled from urban Nigeria to rural Nigeria, and from rural Nigeria to urban Nigeria, and that's going to be reversed when the Yuletide is over. What are the things that you would say people should be very, very conscious of, even now?
Okay, thank you for the double-barrel question. Let me start with NCDC. We work very closely with them, and especially with the Risk Communication Unit, headed by Dr. Diso at the moment. And we must say they're doing quite a lot. They definitely, as you said, they're doing a lot about rumor mongering, about tailoring the messages. But you remember that we are a nation of more than 200 million people. We are a very large nation. So it can't be done from the top alone. There must be that continuous engagement from level to level. And this is where grassroots mobilization, I mean, every grassroots organization should be harnessed in this work against COVID, this response to COVID-19 to mitigate it. If not, really, what is being done at the top will only be a drop in the pan because we are just so vast. So I'll leave that there and let me now talk about, travelers going back and forth. I think I heard the other day on the program, one of your programs, where it was said that, people are taking this, virus into the rural areas. And of course, we know that the levels of vaccination and also compliance with non-pharmaceutical interventions in most of our rural areas is much lower than even in the urban centers where it's not really anything to write home about. So there is a real danger, and we don't want our vulnerable elderly at home to, fall ill from the virus at all. So what we would then say is, again, please avoid all non-essential travel. If you do have to travel, or you are in the process of traveling, because I know many people are right now moving up and down, please use your barrier methods, your mask, hand washing, and physical distancing. It's very worrisome to see that despite the fact that the government has said that, public events should be at about half capacity, we're still seeing people sitting elbow to elbow. I mean, probably sometimes almost sitting on top of themselves. These are, and of course also in indoor spaces. So avoid crowded indoor areas, and please, as much as possible, let where you are be well ventilated. These are ways by which we can mitigate the spread of the virus and thereby halt, the growing spread of COVID-19 and even the new variants coming up, because we have to, halt its transmission to be able to do that.
Well, there are those who will say, well, this is new. What about the ones that have been with us for ages? Lassa fever, cholera, and things like that. And, it would seem like we are paying so much attention to this COVID-19 and whatever other variants that come out of it, as opposed to Lassa fever and cholera that have been with us for donkey years. So what are we to do? How are people to react to that? Because there is a clear and present danger that's been with us for a long time, and then there is this new one.
Okay. Now, there are several ways to look at it. They are all very important. I mean, the DG of the NCDC recently said that the fact that COVID-19 is spiking doesn't mean that the other viruses are going on holiday. So they are all out there, and we have to take precautions for all of them. But I think the reason why there's a focus on COVID-19 is mainly due to the fact that it is a worldwide pandemic and it is novel. But you can see that we're beginning to settle now, and we're beginning to talk about not just COVID-19, but even all these other present dangers. And as you've rightly said, this is the time, the time of the year when we have the transmission of diseases such as Lassa fever, cholera, and cerebrospinal meningitis. Now, they all have slightly different modes of transmission, but the two key things for all of them are, one, the preventive measures, and secondly, for us health workers and for the community at large, a high index of suspicion of any of these. So, recently there was a very sad case with Lassa fever where two specialists at a hospital contracted Lassa fever apparently from a patient who was operated upon and infected by Lassa fever. So it's very sad, and I commiserate with those who are affected, their families, and the hospital. But I think we need to just continue to heighten the index of suspicion when we see things, and remember that we are no longer looking at fever being equivalent to malaria. Now, this is something that many of our communities do not really pay attention to. Someone had a fever, they say, oh, I have malaria, I have cough. But now we need to remember that there are so many causes of a fever or just a, mild illness that should make us go to the health facility and get investigated so that whatever it is can be diagnosed early. And I think that would be my third point, early diagnosis. So we need to look at prevention for each of them, have a high index of suspicion, and thirdly, where unfortunately someone does contract one of these things, early diagnosis is key. So don't stay at home using herbal medications or home remedies, because right now there are so many things about us. So let me rest it there. Thank you.
Honestly, we could go on because I was gonna. Well, we're out of time. Otherwise, I would have wanted to ask you that, especially at a time like this when common cold is common. And that's also some signs of COVID. I mean, it will send people into a lot of hysteria. But let's just go there. You have advised that people should go take some tests just to be sure, because early detection and early treatment would help to stave it off.
Yes, and Tolu, use their masks to keep it away.
Yeah. Dr. Tolu Olufunlayo is Chairman of the Association of Public Health Physicians of Nigeria. She is a consultant public health physician. Thank you so much for your time this morning on the program.
Thank you.